Welcome to this discussion on paracetamol poisoning. We'll be exploring key aspects of this common yet serious condition.
Early intervention with N-acetylcysteine is crucial.
Absolutely. Within what time frame is this treatment most effective?
Within 8 hours of ingestion.
Right. And what's the primary organ affected?
The liver. Severe liver damage is a major concern.
Okay, let's delve into the pathophysiology. How does paracetamol cause liver damage exactly?
Well, an overdose leads to the formation of a toxic metabolite, NAPQI. Normally, glutathione neutralizes it, but in an overdose, glutathione is depleted.
So the liver essentially exhausts its defense mechanism?
Precisely. This leads to cellular damage and potential liver failure.
Can you outline the stages of paracetamol toxicity for us?
Sure, there are 4 stages. Stage 1, 0 to 24 hours, might have mild or no symptoms. Stage 2, 24 to 72 hours, involves right upper quadrant pain and elevated liver enzymes. Then stage 3, 72 to 96 hours, can lead to hepatitis and liver failure. And finally, stage 4, more than 5 days, results in either recovery or multiple organ failure.
Wow, a clear progression of severity there. So how is paracetamol overdose diagnosed?
By measuring serum acetaminophen levels, the NAPQI nomogram helps assess the risk of liver damage. We also use tests like PT, AST, and ALT.
So the nomogram provides a risk assessment?
Yes, it helps determine the likelihood of hepatotoxicity based on the acetaminophen level and time since ingestion.
Okay, what's the treatment for paracetamol overdose?
Primarily N-acetylcysteine, or NAC. Activated charcoal might be used if the paracetamol is still in the gastrointestinal tract. Severe cases may require a liver transplant.
And the administration route for NAC?
Orally or intravenously, depending on the situation.
Why is early detection so critical?
Because early administration of NAC significantly reduces the risk of severe liver damage. It's a life-saving intervention, really.
So time is definitely of the essence. How exactly did NAC work?
It replenishes glutathione levels, helping neutralize NAPQI and preventing further liver damage.
A crucial role in mitigating the toxic effects, I see. Can you elaborate a bit more on the use of the NAPQI nomogram?
It plots serum acetaminophen levels against time since ingestion to predict the risk of liver damage. This guides treatment decisions.
A valuable tool for risk stratification, then. When is activated charcoal used?
In acute cases, if the paracetamol is still in the gastrointestinal tract, to reduce absorption.
A method to limit the amount reaching the liver, right? What are the potential long-term outcomes?
They depend on the severity and timeliness of treatment. Prompt treatment often leads to full recovery. Severe cases can result in chronic liver damage or failure.
Again, highlighting the importance of rapid intervention. To summarize, paracetamol poisoning is a serious condition requiring prompt diagnosis and treatment. What's the single most important message for healthcare providers?
Timely administration of N-acetylcysteine within 8 hours of ingestion is paramount to minimizing liver damage.
Thank you for this informative discussion.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.